All right, let's get started. Am I sharing my sound? Yes. So, my name is Marshall Golden, and my topic is Oppositional Defiant Disorder. The objectives for this presentation, we're going to learn about symptoms, causes, who is most at risk. We're going to learn how to measure the severity of the disorder, how it's identified, treatment, the latest findings in psychology related to treatment, and other findings for the disorder, and strategies for the classroom. About me, I'm a second-year special educator. I taught at Meade High School for Anne Arundel County Public Schools for the 2019-2020 school year. I really liked it, but was a career changer. I didn't really suspect I would be a teacher, but I want to try working in a public or a private school rather. So I'm currently working at the High Road Upper School of Prince George's County in Lanham, Maryland, and there we specialize in working with students with emotional and behavioral disabilities. So, Oppositional Defiant Disorder, ODD, the basics. We're going to watch a quick video. This girl's like kind of acting out a prototypical ODD child.
Welcome to a trial today.
I point out the truth to people, and people can't handle the truth.
What is an example of your pointing out the truth?
Like telling the guidance counselor she's fat because she is fat.
You felt a need to tell her that?
She ran out of breath just walking up a few little steps to the Board of Education office. And then she told me I couldn't smoke on their property because smoking is bad for people's lungs. I breathe fine. I'm not round like a pumpkin. That's what I called her. Pumpkin butt.
Did you feel bad at all about calling her pumpkin butt?
No, I did not feel bad. It was her fault. She started it. Treating me like a child who can't make my own decisions to smoke or not to smoke.
Her fault.
Yes.
Okay. I think we've all seen that.
Welcome to a preview.
There we go. I think we've all seen that student before. But let's talk about some of the characteristics of ODD specifically. They're usually identified in childhood. They're hostile, aggressive, and argumentative towards their peers and adults. They're easily upset by others. They're resistant to structure and what they perceive as arbitrary control, which is actually kind of wild because what we've seen in some of the treatment is that structure is actually what helps them the most. They have frequent temper tantrums. They're vindictive. When they're slighted, they can be very single-minded in trying to even score. And then as we saw with the girl in the previous video, there's lots of blame shifting, but unfortunately, it's kind of difficult because this sounds kind of like a teenager, but we'll see that it goes a little further than that with ODD. So the causes, psychologists don't know for sure what causes ODD, but there are two main schools of thought. The first one is a lot like nature nurture. The developmental theory, the child had difficulty learning independence from their primary caregiver, and the manifestations that they, the bad behavior, that would be normal behavior for childhood, but because it's taking place in adolescence, that's what the problem is. It's taking place at the wrong stage of development. And then the learning theory, which is essentially they just mirrored the behaviors of the adults that raised them, and they use negative reinforcement as their chief strategy to get attention from peers and their parents or just other adults. Which children are at risk? So boys are overrepresented in ODD cases. Those who suffer from mood or anxiety disorders are also predisposed to ODD. And then one of the studies I used, Connor, he found that it's possible that more than half of ADHD cases are linked with cases of ODD and other conduct disorders. And we'll see in lots of studies, they're typically studied alongside each other because they have a high rate of comorbidity. Who diagnoses ODD? It's typically going to be a group effort where people all kind of come together and there's an issue that is underlying all of these people, and the common denominator is the child. So officially it's going to be done by a mental health expert, but it's going to be a host of people that really recognize the problem. So the DSM-5 criteria, the updates from the DSM-4, the new criteria includes the symptoms manifesting for at least 6 months on a consistent basis. And the criteria also required that these behaviors take place with non-family members because the pool is getting a little bit diluted with kids that just fight with their siblings. All right. ODD ranges in severity. It's classified on a spectrum by psychologists from mild, moderate to severe. The mild, it's determined based on the symptoms manifesting in one setting, moderate, the symptoms manifesting in two, severe in 3 or more settings. So that's kind of the metric they use. So the impacts. So the obvious and most recognizable one is the academics and their personal relationships. Those are the most immediate impacts for ODD. But longitudinal research has some interesting findings. One is that ODD, which is like commonly comorbid with CD, CD is a higher likelihood of substance abuse and bipolar disorder. But with ODD, there's other long-term side effects. And we can see that in this other study that I found where they broke the kids into a control group, an ADHD group, ADHD and ODD group, and an ADHD and ODD and CDD group. They were evaluated at a baseline, 1 year, 4 year, and 10-year interval. And according to Biederman, who took the study, between the 4 and 10-year follow-up, ODD correlated highly with reports of major depression, regardless of comorbid conduct disorders. So that tends to be what we associate with the most serious negative long-term impact of ODD during adolescence and into early adulthood. The treatment is actually a lot of parent training, like helping them identify triggers, learn how to mask their frustrations, things like that. It's a lot of teaching them to, like the stuff that we do all the time. They have to learn that. And then parent-child interaction therapy, therapists will give certain scenarios and the parents will act them out, and they will receive coaching from the therapist. Then the child's training will be social skills training, learning to see things from other people's perspectives, that sort of thing. And then cognitive problem solving training, essentially just working your way through difficulties in life without exploding into a temper tantrum. Essentially, that's what is associated with that. And then individual and family therapy, obviously. And then if it's comorbid with relevant conduct disorder issues, they will typically prescribe ADHD medication like amphetamines. So the good news, early intervention programs have proven effective in preventing the onset of ODD. So the Royal Children's Child and Adolescent Early Action Program was one that was fairly successful. They used a strength and difficulties questionnaire and a child behavior checklist, and it resulted in, over a 4-year period, a reduction in teacher-reported and parent-reported symptoms, both internal and external. So this last section, I wanted to discuss a TACT verbal training that I received, and we kind of went over how to walk through power struggles, which are like a big part of, you'll see it in the verbiage surrounding ODD, it's power struggles. So essentially what we were taught by our trainer is that it's best to ignore what isn't important. If they're tapping on their desk, that is a form of a power struggle. They know it's your job to keep the class orderly. And if the class is quiet and they're like impacting that, they're trying to like seize power from you. But if everyone's focused and listening and no one's complaining, then just let it go. You don't have to fight every battle. When they are doing that and they're disrupting someone, because I told you so is not supposed to be your answer, especially with ODD students. You usually want to say, hey, because people around you are having a hard time focusing, and I just think it would be nice if you were considerate to others. Could you please stop that? Another strategy they taught that I really liked is you can let the student get the last word. And the reasoning for that is A, you're the adult, and then B, I don't want to do this assignment is not an argument that validates their objections and doesn't require a response. You want to develop a system that takes a little bit of time for them to understand your willingness to adapt to them, but teach them that you can accommodate their goals for the class. So essentially, if they express their objections in a valid manner, as I showed here, is I don't want to do this assignment because it's too much like what we did the last 2 weeks. And I feel like there are better ways to demonstrate what I learned. Okay, that's an argument, and it's a very logical argument. We can start to work from there. Maybe we can find a different way for you to demonstrate your understanding. Just let them know that that's a good way to compromise. Here are my sources. I hope you learned about what you learned about ODD. I hope you learned a good bit about it. And thank you for logging in and checking it out.